So we have many novel therapies for myeloma, starting from CAR-T cell therapy with 2 approvals in the United States and 1 approval for bispecific antibody teclistamab. Several are coming down the line, right? However, there are several challenges for our patients to access these therapies, which I talked about in my session at ASCO. In particular, we focused on CAR-T cell therapy, which is a complex therapy, right? Most patients are not treated at the centers that do CAR-T. So they need to be referred. Once, they require referral, so that creates disparities in access, especially racial and socioeconomic disparities. We see that African American patients do not get CAR-T at the same levels as other patients. We see Hispanic patients are not able to access CAR-T at the same level. There was a study that found that CAR-T trials and bispecific trials aren't even open in counties where most African American patients live, right? So those are challenges. Then for clinical trials, the eligibility criteria for these novel therapies are so stringent that the majority of patients that we see in our clinics would never meet those eligibility criteria. So there's several barriers to getting, access to those therapies. Even if they walk into our door, the other barriers that we have is limited slots for CAR-T at present. Manufacturing is a complex process and requires special facilities, trained personnel, viral vector, and lots of regulatory oversight. And we have a challenge with slots right now. Manufacturing time is long, right? Even when we do all of that, patients need to relocate, and that causes caregiver burden, financial burden. So those are all of the challenges we have in getting our patients access to all these amazing therapies we have.